Good morning. This is Dr. Thomas Bartell, board-certified plastic surgeon specializing in body recontouring surgery. And today I'd like to talk a little bit about an area of cosmetic surgery that's not really spoken about very much, but it's an area that's gaining in popularity quite a bit, and that's cosmetic surgery for men. Now, men don't like to talk about this or don't like to pursue this as often as women do, and there's no question that most of the body recontouring, and actually all of the cosmetic surgery, is still performed on women. But men are increasingly becoming more interested in knowing what can be done to improve their appearance. Now, if you're talking about just general aging, such as in the face or the neck or that kind of thing, now that's not something that I do anymore, but if for men who are interested in that kind of thing, I have a great solution for you, and he's called Kevin Robertson. Robertson Cosmetic Surgery here in Madison. He's the best. So I would suggest you make an appointment over and see him. But if it's body recontouring you're interested in, you come make an appointment with me and we can go over the options. Now, the areas of most concern for men tend to be the chest and, of course, the abdomen. Now, chest recontouring, which a lot of men call their man-boobs, that is something, if you go on the internet and do some research, you're going to come across a word, gynecomastia. Now, that is a true medical condition, but I tell you, the number of times I've seen true gynecomastia in the last 30 years, I can probably count on one hand. It's not true gynecomastia that most men come in and see me about. It's something called pseudogynecomastia. That's an issue where it's really the problem is really just a lot of excess fatty tissue that's around the chest. And that problem is addressed mostly with a lot of liposuctioning. Fortunately, that leaves very little scarring on the chest itself. Now, if the cause for concern for the chest to be recontoured is more severe than that, if there's excess skin, for instance, or if it's a transgender type of individual, then there has to be some skin removed. And whenever you remove the skin, I'm sorry, you got to leave scars. Now, I try to put the scars in a place that's right in your natural crease, the chest crease, so that eventually when the scar fades, it looks just like a crease in your chest. But there's just no way to remove skin without leaving a scar. That's not my rule, that's her rules. So you have to be able to put up with that. And that's also the case when you have a patient who's undergone some type of post-bariatric surgery, and they've lost a lot of weight, and now they have skin that tends to hang in several well-recognized places. One of them's on the chest, one of them's on the arms here, usually it's the abdomen and the inner thighs. These are areas that they need to have their skin removed after they've lost 75, 100, 150, sometimes over 200 pounds, and that leaves a lot of sagging skin. And although they feel better, they probably look better, and it's more healthy for them, they still have these problems that they just don't want to go out in public and see this sagging skin. So those are the areas that most men are interested in. And then of course there's this typical liposuctioning, or if they want a tummy tuck, although it's much less frequent than women. I do that on occasion on men, just to give them a nicer contour on their abdomen as well. So those are the areas that I see. And as I say, men are becoming increasingly aware of the possibilities, what can be done for them, and how they can do something to improve their appearance and the way they feel about themselves. So that's what I have today. I'm taking on a new exalted position next week. I'm going to be an FOB, the father of the bride. We have a wedding coming up next weekend, and I'm looking forward to that, although I'm a little nervous about it too. I've never been a father of the bride before, but I'm looking forward to having this wonderful young man join us in our family. So we won't be on the air next week, and I'll let you know how things went when I see you in 2 weeks. Take care, everybody.